Now, the Health Secretary Therese Coffey will today announce a new plan to tackle the NHS backlog in the run-up to winter.
NHS's own data shows not a single trust in England met any waiting time targets during the year from April 2021 to March this year.
Well, let's talk to the former Health Secretary Stephen Dorrell, who joins us now. Good morning to you. It's nice to see you. What do you want to hear from Therese Coffey today, and how do you think she's going to achieve anything, actually, at the moment?
Well, I think she's obviously got an extremely difficult task. The NHS responded heroically to the pandemic, but we've been left with very long waiting lists for planned care, very long delays for access to urgent and emergency care, both in hospital, as you mentioned, and also, of course, in primary care. So I think there's two things that I would put firmly on the agenda that I think this Health Secretary has to address. The first is that it simply isn't possible to bring the health service back into the kind of balance that we would all want to see without addressing funding questions. So I think people will be listening for that. And the second thing is to remember that the government is actually the new government is sending out mixed messages here. Because on the one hand, Therese Coffey quite rightly wants to address the pressures on the health service. At the same time, the wider government is downgrading its obesity strategy, which will lead to more heart disease, cardiovascular, diabetes cases. So on the one hand, it's reducing prevention interventions, and on the other hand, it's saying it's going to try to address the avalanche of demand that's being felt across the health and care system, partly as a consequence of the pandemic, although, of course, it was building before the pandemic.
Is just simply not having enough GPs, isn't it? I mean, I know what Therese Coffey is going to say is they're going to try and devolve some of the GP responsibilities to very senior nurses and to pharmacists. We've heard a lot of this before in the past. But the true fact of the matter is 1,700 fewer full-time equivalent GPs today than there were in 2015. And until that changes, trying to see a doctor is always going to be hard.
Yes, but can I focus for a second on the point that by downgrading the obesity strategy, what the government is doing is building demand for GP services and primary care and indeed hospital services. So the government needs to recognise that health strategy is not just about treatment within the NHS. It's also about intervening to prevent people becoming unnecessarily ill. It's also about, as Liz Truss said during the leadership campaign, it's also about addressing the issues in social care. You can't deal with these issues just one at a time. You have to deal with them together.
But that's looking at, I mean, the problem with all of this is it's such a huge issue to deal with, isn't it? It's a case of how you prioritise some of that. And that's the big issue she faces. I mean, guess what? Most people are going to be looking at needing to see the GP. And as Isabel said, farming it off to the pharmacies, well, that's good, except the pharmacists aren't happy with their contracts at the moment. They feel they're being underpaid already.
Can I suggest, you're right, these are very complex issues and it's difficult to find your way into them, particularly when they are as pressing as they have become over the last few years. But can I suggest a way of addressing it, which is to focus first and foremost on the individual citizen who is finding their health not as good as they would want it to be. And if you focus on individuals, then the first thing all of us want as individuals is to avoid being ill if we don't need to be. So if you focus first on prevention and then on early intervention and then on intervention in the community, rather than always starting with the very important issues in the hospital, you've got, I think, more chance of addressing health issues rather than just healthcare, or even worse, if I may say so, just hospital healthcare issues. It's the health of the individual citizen that should be our starting point.